session, we will discuss the skull. We will basically do a revision of what we have taken in the skull sessions earlier. So, talking about the skull, we whenever we have to describe the view of the skull we are talking about, we say these are the normas. So if you're looking at this front view right now, this is norma frontalis. So if you rotate the skull to the side, to the lateral side, so this view is known as norma lateralis. If you look at the vault or the skull cap from top, so which view are we seeing? This is norma verticalis. Looking at the back of the skull, this view of skull is known as norma occipitalis. Right. So if you just turn the base down, on the lower part of the skull that we are seeing will be known as the norma basialis. Right. Now let's talk about the features that we see in the norma frontalis. So norma frontalis is made up of frontal bone. It's made up of zygomatic bone. It's made up of maxilla. Two maxillae, they fuse with each other and they make the boundaries of the nasal cavity. Inside the nasal cavity, you are seeing this highlighted area. This bone is known as vomer. Right. So these are the nasal bones, right and left nasal bones. The suture here between the frontal bone and the nasal bones, the suture in between, it's known as the nasion. All right. Now, looking at the frontal bone, here. So, this is a mandible. Its description you can see. All right. Now, let's move on to the orbit. In the orbit, you will see that the roof is made up of frontal bone. Laterally, you will have the zygomatic bone. Medially, you will have the maxilla. Maxilla is also forming the floor of the orbit. You are seeing the orbital part here. Right. Now, if we move a bit inside, you will see that the roof of the orbit is made up of frontal bone. And on the sides now, on the medial aspect, we will identify this bone here. It's known as the ethmoid. Ethmoid, you will see it part in the nasal cavity, forming the walls of the nasal cavity. Superiorly, it will extend up to the front, the cranial cavity, forming the cribriform plate there. It will form ethmoidal air sinuses, and it's forming the medial wall of the orbit. Now in the orbit, you will see that there is a, let me bring it down, there is this small bone, separate bone, known as the lacrimal bone, a very thin bone. The lacrimal bone is also known as lamina papyracea. All right. Now, what are the foramina that you will see in the orbit? And apart from these, you will have a contribution of the sphenoid bone also here, which is the butterfly shape. You are seeing its extent now, how it's extending. So if I just press on the bone here, this is the extent of this sphenoid bone. We have discussed it in many regions. Its plates, you can see the medial and lateral pterygoid plates highlighted green. You are seeing its greater wing here from the external aspect also, and you will see it forming the present near the apex of the orbit also. So these are by far the bones that are forming the orbit. Now let's look at the fissures and foramina that are present. The long oblique one at the back, this is the superior orbital fissure. This one, highlighted one. Yeah, moving little bit down here, the rounded circular one that you see here, this is the optic canal. The optic foramen leads into it. Down here, the lower one, this is the inferior orbital fissure. Then you have the inferior orbital foramen present on the maxilla. Right. Okay. Now we have the maxilla, two maxilla forming the upper jaw. Upper set of teeth are present there. The lower set of teeth are formed by the mandible. Okay, so this is norma frontalis. Now when we look at the norma lateralis, let's try to identify the bones again. So we have the frontal, we have the parietal, we have the temporal, and a part of the sphenoid bone. Now this H-shaped suture that you're seeing here formed between these bones, this is known as the pterion. I told you the significance of the pterion with the middle meningeal artery, that it lies exactly behind it, and we can do a surgical procedure during decompression or reduction of intracranial hemorrhage from this pterion. So basically you can locate your middle meningeal artery behind it. Now from the temporal bone, what are the projections that we see? We are seeing this rounded one down. This is known as the mastoid process. You're seeing the spine-like projection here. This is known as the styloid process. All right. Then you have the external acoustic meatus, this opening. You have the zygomatic arch going towards the zygomatic bone. You're seeing the temporal lines, the supratemporal lines, the markings on this aspect. Now moving back to the norma occipitalis, three bones are present there. You have the parietal bones, you have a suture between the parietal bones, and you have the occipital bone. This suture is known as the lambdoid suture. This is the sagittal suture. You can see the parietal foramina there on the sides. Separating the frontal bone from the parietal bones, the suture is known as the coronal suture. You are seeing the extent of the coronal suture down, right? Then you have to identify the pterion, this H-shaped suture present between different bones. So these are some of the landmarks that you have to remember for the skull, right? Now, what are the muscles that we will see being attached to this? So in the neck zone, we have not still reached the muscles of the neck, but orbit we have taken. So you're seeing that in the orbit that there is the eyeball with the extraocular muscles, right? Then, yeah, for the face now, you're appreciating here over the nose, this is the nasalis muscle. Around the mouth, this is orbicularis oris. You are seeing the mentalis muscle on the chin. Right. Now you're seeing the frontal bellies of occipitofrontalis. This white color sheet is the galla aponeurotica. On the back of the galla aponeurotica, you will see the occipital bellies of occipitofrontalis. So this is how the occipitofrontalis muscle looks like. This is the aponeurosis or the galla aponeurotica. Right. Okay. Now this is the masseter. Here inside you can appreciate the buccinator. Yeah. We are seeing the levator anguli oris. Okay, now moving on to the eyeball here. You are seeing the superior rectus, medial rectus, inferior rectus, and lateral rectus in this view. Now, if you move a little bit inside, you are seeing the sling-shaped inferior oblique arising from the orbital plate of maxilla and going towards the lateral side of the eyeball. Now, if we move a bit more inside, let's see the superior oblique muscle. Superior oblique muscle inside. Right, you're seeing the lacrimal gland also in the place in the lateral side. Right, this muscle over the nose and the supraciliary margin, this is known as the corrugator supercilii. Now here zygomaticus major and minor have appeared. You're seeing the masseter. This is the masseter. Temporalis muscle from the temporal fossa. Right. Okay, now a few more muscles. This is platysma. So your platysma is here. Right. You can see the orbicularis oculi muscle. Okay. Masseter. These are the small muscles of the external ear, the pinna, known as auricularis superior. Okay, a bit of temporoparaetilis muscle and auricularis anterior muscle. These are arising from the external ear or from the pinna. Okay, so this is your trapezius, big sheet that you have here. Okay. Levator labii superioris, zygomaticus minor, zygomaticus major. Right, so these are some important muscles in the face that we have discussed and we have identified them now.